Good morning. I am Anja S. Varghese from Emmanuel Arsa College of Pharmacy. In this video, we are going to discuss about prescription writing. This topic of discussion will be help you to know what is a prescription, is why it is written by, and how it must be written. By understanding your prescription, you can avoid error in your medications and treatment. Let me start with what is a prescription. Actually, is a prescription is an instruction to a pharmacist written by a physician to dispense a started quantity of a particular drug in a specified dosage. A prescription also contains instruction to the patient indicating how the drug is to be taken, how often and for how long a prescription abbreviated as RS. So long as there were medications and a writing system to capture direction for prescription and usage. Therefore, preparation and usage there be a prescriptions, modern prescription are actually extemporaneous prescription, meaning non-extemporaneous prescription that is genetic recipe for a general ultimate modern prescription evaluated with the prescription for a rule of a pharmacist from that physician. Today the term extemporaneous prescriptions is received for compound prescription that the pharmacist for mix for compound the medications in the pharmacy for the specific need of the patient. It is important for you to understand the types of prescription before we move towards how to a prescription must be written. The type of prescription are number 1 simple prescription, number 2 compound prescription. Then first one simple prescription written for single component for pre-fatigable product not require compounding or administered by the pharmacist. Second one compound prescription written for the more than a single component and require compounding. E-prescription generation of prescription by electronic means used in some countries. Then fourth one inpatient prescription, a medication order from used in a hospital settings. In addition, other forms may be used by a specialized unit like infection disease, cardiac care and pediatrics. Drug specific from may also be used for heparin electrolyte infusion, morphine sulfate in patient control anesthesia. Then fifth one narcotic prescription contain narcotic and other habit forming drugs. Content of simple prescription, narcotic register number of prescriber, address of patients. Written by typewriter, quantitative must be written in words and numbers. How to write a prescription? Parts of the prescription. First one date, superscription, inscription and subscription and transcription and signature. Second one date. Written to know when medicines was last dispensed, prevent misuse of drug by patient. Superscription contain information about prescriber, first one name, address, telephone number, information about the patient's full name, address, gender, date of birth and weight and height if necessary. Next, inscription. Inscription is main part of the prescription. Give information about name of the drug, formulation and unit dosage. Next, subscription. Provide information to pharmacist about the quantity, dosage form of the transcription. Prescribe directions to the patients contain instruction about amount of the drug, time and frequency of the dosage to be taken. Last one is a signature. Prescription should be signed by a prescriber. Refill instruction if needed. Special instruction if any must be written. Next, move on the visual representations of subscription. First, information of the prescriber, patient information, data is also given. Second one, inscription and subscription. Name of the drug, dosage from the drug, instruction about amount of the drug, time and frequency of the dosage to be taken. Then signature and instruction. Prescriptions are important target area for in Next, prescription error may occur due to inadequate knowledge of patients and clinical status, inadequate drug knowledge, calculation error, illegal handwriting, drug name confusion, poor history taking. In 2017, over 4 million prescriptions were failed across United States. First, prescriptions are key source of medical error, account for 70% of medication error. Ineligible handwriting, use of abbreviation. Make sure to solely write down prescription, then risking your patient health. That's all about prescription. Thank you.